Hello, this is Dr. Mukta Nadig, Senior Consultant Obstetrics and Gynecology in the Cloudnine Hospitals in the Malleshwaram branch. Okay, once we have done a detailed history taking, physical examination and done all the diagnostic tests, we should be able to clinch the diagnosis and arrive at a cause for the abdominal uterine bleeding in this particular woman. Management depends on the cause. And of course, we have to keep other factors in mind, that is the age, the parity, the desire for fertility, and the cause for infertility if there is any. Suppose we find a polyp. Polypectomy is the method of choice, and for this we should use the hysteroscopic method if in an urban situation. If hysteroscopy is not available, then a plain polypectomy can be done under ultrasound. After the polyp is removed, it should be sent for biopsy, and if the benign nature of the lesion is confirmed, then we can wait and watch the woman's cycles. If the cycles are improved by the polypectomy, then nothing needs to be done. In case she recurs with the abnormal bleeding, then oral progestogens or symptomatic treatment can be offered, or even an LNG IUS, that is a levonorgestrel intrauterine system, which is a very good method of administering hormones to the lady. Other cause which we could find locally is adenomyosis. And adenomyosis, again, if she's a young nulliparous woman with the symptoms, then we can give symptomatic treatment that is non-hormonal or hormonal, as the case may be. If she's an older woman, parous, and does not desire fertility, then an LNG IUS can again be offered. If she refuses an intrauterine contraceptive device, then GnRH agonist can be tried in her, but for a short term. But if she's a parous, older woman, refuses all the above, then hysterectomy is the treatment of choice. In case of fibroids, if we find fibroids in the uterus, these need to be mapped and seen regarding the location and the size of the fibroids. If it is a large fibroid and subserous and she is an older woman, parous, then myomectomy has to be offered, which could be a laparoscopic or a laparotomic. If she is a younger woman and the cause of infertility is found to be the fibroid, and if it's a submucous fibroid less than 4 centimeters, then a hysteroscopic myomectomy can be done. If it's a young woman and it's a cause of infertility, but it's a subserous fibroid, then a laparoscopic or a laparotomic method has to be approached. If she's again a nulliparous and a young girl, with only symptoms of fibroid and small fibroids, we can wait, give her non-hormonal NSAIDs or tranexamic acid, or even cyclic contraceptive pills. In case of malignancies, of course, the surgical removal of the uterus is what is called for, with operative intervention by the oncology team also, and further therapy has to be decided based on the biopsy and the location of the malignancy. Malignancy could be anywhere in the cervix, in the uterus, the uterine body, or even in the ovaries. So depending on where the site is and the biopsy, we have to plan our surgery and further therapy. Now in the non-structural causes, that is the coagulopathies, the hematologist should be involved, and depending on factor which is absent, that factor has to be replaced. Concomitantly, she can be given non-hormonal medicines or even cyclical progesterones. In this case, we should remember that we should not be giving NSAIDs, and also we should avoid doing intravenous or intramuscular injections to her, as it may cause further coagulation problems. Now in the ovulatory dysfunctions also we have to use cyclical or sequential hormones, which could be plain progestogens or contraceptive pills, that is combination pills. In this also we can use non-hormonal methods. LNG IUS can also be inserted if she refuses oral hormones. Now in iatrogenic causes, we should find out what is the drug which is causing the abnormal uterine bleeding and either taper it, stop it, or change it, with consultation with the person who is giving it, that is either the psychiatrist or the anticoagulants which have been provided to her. If it's an IUCD which is causing it, as I said earlier, we should first rule out the coincidental causes of abnormal bleeding, and then pin the nail on the IUCD and remove it.